Your lips ends at your hips, okay? Goes from your lips, guys, all the way down to your hips. Now, digestive system is broken down into primary organs and accessory organs, okay? A primary organ of digestion, guys, your food substance goes through the organ. Okay, once again, a primary organ of digestion, your food substance goes through the organ. Accessory organs of digestion, guys, the food source does not go through the organ, but that organ is hooked up to the digestive system. Okay? Now, an example, guys, of accessory organs of digestion going to be the liver, the gallbladder, and the pancreas. Okay? Liver, gallbladder, pancreas. Okay, yes? No.
Oh. Oh, they have it all.
They're not considered part of that. Because I think the glands are a organ like.
What do you say? Liver, gallbladder, and what?
Pancreas.
Okay, so guys, we're going to start right here, guys. What you need for the
What picture are we on right now?
digestive system, guys.
576.
Of course, what cavity is this? Oral cavity. Okay, guys. You also need to know the boundary between the oral cavity and the nasal cavity is going to be the hard and soft what?
Palate.
Palate. Okay? Now, at the end of the soft palate, guys, we have that thing that hangs down the back of our throat called the what? Uvula. Guys, here's the uvula right here. Okay? That's that structure hanging down in the back of the throat. It's at the end of the soft palate. Okay? Now, coming in, guys, through the lips, okay? We're going to have a gap between the lips and your teeth, okay? Lips and your teeth, guys, that is called the oral vestibule. Oral vestibule, okay? Between your teeth and the lips. Okay? Everybody go with that? Next thing, guys, we're going to do is we're going to come in here and we're going to look at this big muscle here. What is it, guys? That is your tongue. Okay? Your tongue, guys, is actually two muscles that are combined together. Okay? Two muscles combined together. You actually have a left and a right side to that muscle, guys. And if you've seen those people that split the tongue, they get that surgery. They split the tongue like a snake's tongue, and they can independently move the muscles. Okay, pretty weird. Okay? Okay, so here's the tongue, guys. Okay. What else do you need from there? Let me see what else we got there. You're going to need back here, guys, what is this spot right here? Yep, that's the oral pharynx back here. Okay. All right. Okay. Now, yes. No, just the tongue itself, guys. If I do use it, I just tag the whole entire tongue. I usually ask more questions on the tongue in lecture. Yes? What's that? The tonsils? Yes, they will move because they're connected to soft tissue. And that's why a doctor, if he wants to see them, he makes you open your mouth and say, ah, because you'll move the structures in there for better view. Okay? Question over here. Anybody have questions?
Do we have to know the teeth also?
Yeah, the teeth we'll get to in a minute. Okay. We used to have teeth that probably in the other lab. Oh, here they are. She's playing with. There you go. you go to play, you gotta
It's
play
the
big.
whole thing.
It's like building blocks.
Look at all the stuff I have here. It's set.
Good boy. Okay,
It's not that bad.
all right. Now guys, underneath your tongue, you'll notice that if you flip it back, there is a little thin piece of skin or flesh there, okay? That is the frenulum, okay? Here's the frenulum right here, okay? Uvula in the back, okay? We don't need the arches, guys. You don't need the arches or anything else in here.
What was the
okay?
frenulum again?
Frenulum, that piece of skin holds the tongue down in the center of the lower
That says lingual.
portion there.
I'm just circling the
Now, next thing you will need, guys, are the 6 glands, okay, that we use for helping digest food, okay? First one we're going to look at, guys, is the parotid gland. Parotid gland, guys, is on the side of the mandible, right here, okay? There's your parotid gland, okay?
Oh, parotid.
Parotid, okay? And then, guys, we're going to have a set of glands underneath the tongue called the sublingual glands. Sublingual. And then we're going to have a set slightly posterior to them, but deeper, guys, in the mandible, okay? And those are called the submandibular glands, okay? There's going to be 6 of them, 3 on each side of the head, okay?
I'm gonna just to clarify,
Yeah.
so one parotid, one sublingual, and one submandibular on each
On
side.
each side, yes.
So we just have,
Okay?
Wait, hold on, what?
we just have to know the glands
What do you mean?
and the ducts.
Just the glands.
Okay.
Wait, which one is 3 of them on each side?
What's that?
3 of them on each side?
Yeah.
Oh, okay.
There's the
sorry.
sublingual, the
Okay.
Sublingual under the tongue, submandibular under the mandible, and then the parotid on the sides,
and that's
Thank you.
okay?
There's only one under the tongue, right? Well, I mean several, but
just 3.
Left and the right.
Okay.
Yeah, there's double, that's why there's 3 here,
Just
and
3.
there's 6 in the body, on the head. You got the same 3 on the other side, left and right sides, okay? Here they are, whoop, nice bigger shot here, guys. Parotid, sublingual, right underneath the tongue, and the submandibular guys down by the mandible, okay? Okay, ooh. Next thing we're gonna look at, guys, are the teeth, okay? Okay, now guys, the first set of teeth right in the front of your mouth, okay, is going to be your incisors, okay? Incisors, guys, those are going to be teeth that are used for biting things, separating, cutting, okay? Those are the incisors. You're going to have 2 on the upper jaw, 2 on the lower jaw, okay? Going out from there, guys, we're going to go into some pretty nasty, rounder looking teeth. They look like fangs, and those are your canine teeth, okay? Canines, guys, they got their names from the dogs because a canine has those very, very large fangs, okay, that usually scare people when you see them, okay? Some people have large canines. I know my daughter, my oldest daughter, she has a pretty good set. Looks like she's a vampire, okay? Just the way she was developed. And some people pay to get them increased, okay? So there's the canines, guys. Then we go out, guys, to what we call the premolars, okay? Premolars, 2 sets again. So you're going to have 4 of the premolars. And then finally, guys, on the back sections, we will have the molars. And it's going to be 6 molars, all right? Now, anybody here ever hear of wisdom teeth? Okay?
Cool.
Wisdom teeth, guys, usually pop up behind the molars, okay? And the problem with wisdom teeth is that when they come in, guys, let me see if I have a picture of it. They usually pop in back here, so they're jamming up against the mandible, okay? And they push into your normal teeth. So usually when wisdom teeth come in, you'll have a shifting, guys, of your other teeth. So usually it messes up your alignment, okay? Also sometimes, guys, the wisdom teeth are so big when they come in, they'll whack the last molar and you'll have pain. It will start pushing down your last tooth and you have to get those things surgically removed. Okay, yes?
There's sometimes when it's tilted like that, like my surgeon gave me a warning that I would lose sensation
Uh-huh.
in my taste.
Really?
That's like one of the dangers if it's tilted in a way, because
Right,
it's
right,
right
right.
by a nerve.
I didn't think you'd lose the taste.
That's
there.
what he's
Wow.
scared the hell out of me.
Right, so you had the surgery.
I had it anyway, yeah.
Okay. What surgeon did you go to?
I forget. It was some.
Write
It was
that
a good.
down.
It was a good.
Look
Write it
your
down and give.
hospital.
All right. I'll give it to you.
I
With
ain't
the hospital
going
that I
in.
work
I ain't
at.
going to him either.
All right, cool.
Okay. All right. Now, guys, parts of the teeth, okay, that we'll look at here, guys. The visual part of your tooth, guys, that is called the crown, okay? That is the visual portion of your teeth. That is the crown. The crown, guys, is made out of the hardest substance in the human body. Does anybody know what it is?
Enamel.
Enamel, okay? Enamel, guys, is the hardest substance in the human body, way harder than bone, okay? Now, guys, the problem with having something so hard is that it doesn't flex. So if you overbear or force that structure, he can't flex. So he just does what? He just cracks, fractures, blows apart, and you chip your tooth. Okay? Now, since this is so hard, guys, most things don't really affect it much. Okay? But the problem with having something so hard is that it can decay. Okay? So what messes up enamel, guys, is going to be the acid in your mouth, okay? And decay from having food substances stuck on them, okay? Now, guys, when I was a young kid and we used to go to the dentist, we used to go there, and after you had anything done, he'd send you out to his secretary and she would give you a treat, okay? And what the secretary would give us was those little red boxes of the raisins, okay? Guys ever seen those little red boxes of the raisins, okay? And we used to love them because they were sweet, all right? Years later, what I realized, guys, was that raisins are one of the worst things for your teeth, okay? Because when you eat raisins, what do? They get stuck in between the teeth, okay? The only way to get them out, guys, they don't dissolve well with water. You gotta scrape them out, okay? So, as I got older, I was like, look at this bastard. He's working on our teeth, and then he's giving us raisins so that we get more what? More cavities, right? He's making sure that we remain his patient, okay? And he's always got business, okay? So guys, who used to get the bad rap all the time was what? Candy, chocolate, things like that. Guys, you put a candy bar in your mouth, how long does it last there?
As long as it's stuck.
Few minutes, right? Your body does what with it?
Absorbs it.
Breaks it down, bang. Okay? You eat raisins, they stay there. You eat oranges, they stay there. You eat plums, they're staying there. Okay? All the good stuff, guys, all the healthy stuff is what? Sticking to your teeth. Okay? You gotta brush them and floss in between them, guys, or else you're gonna wind up with these crazy cavities. Okay? Okay, now that's the enamel up top, guys. Underneath that, we're going to have a substance very similar to bone, guys. This is called dentin. Okay? And that's where the old term dentine gum came from. Okay? Right here, guys, here's dentin. Oh, that's another thing. What did they teach us, guys? Well, I don't know about you guys, but they used to teach us never eat what? Why? Because it cleans your freaking teeth. Okay? Guys, when you chew gum, the shit that's stuck in between your teeth gets trapped in the gum. The gum pulls it out. Okay? Takes it off the surface of your teeth. Your dentists don't want that. Don't chew gum. Okay? Right? Think about it. You eat, the first thing you want to do is what? If you ain't got access to a toothbrush or a floss, chew gum. Okay? It will help lift the crap off of your teeth.
And I hear it also promotes the flow of saliva as well.
What's that?
The flow of the saliva inside the mouth.
Well, that's because of the acid.
Right.
Right. So that would do it too. Okay? So, guys, this dentin, that's similar to bone. Down here, guys, we have our roots. These are the roots that go into our mandible and our maxilla bones. Okay, those are the roots. And guys, you can see through the roots, we're going to have our root canal, which will have an artery, a vein, and a nerve going into them. Okay, yes?
So what do they? I've heard that word. When they give you a root canal, what
Yes.
exactly do they do?
Okay, guys, if you have a root canal, what's usually happening is you have a very large cavity up top, and it's actually hitting the nerves over here, so your mouth's lighting up. Very, very painful, so you go to the dentist, okay, and what they're going to do is they're going to drill the top out, and they're going to take a little micro drill bit, and they're going to come down here, twisting it, and they just yank out the artery and the vein and the artery, artery vein and the, I'm falling asleep already, I'm going to be shot, and the nerve, okay? Now guys, once they take out the nerve, what happens to pain? It's gone. You don't have a receptor anymore to tell your body that this thing hurts. Yes?
But then how does your teeth get like the calcium it needs?
They don't. So once you have the root canal, guys, they just denerve the root. They just knock the blood supply out of there. What happens to the tooth?
It rots.
It dies. Your tooth dies. Okay? Now, the only thing holding it together, guys, is whatever was structurally there. Okay? That's why people that get root canals, usually within a few years, what happens to that tooth?
You get a crown.
It just blows apart. Bang! They bite onto something, and it just fractures because it's dead. Okay? And it blows apart. And now you need to have the root surgically removed from your jaw, and you'll need a, well, today they do those, the implants. Yes? Baby tooth?
That's what I would do.
Go to the dentist and kick him right in his nuts. Okay? You never ever let somebody correct, especially a root canal on a baby tooth. The kid's gonna lose it in a few freaking months.
Well, unless you don't have a replacement, because let's say you have a baby tooth and you don't have a replacement,
Yeah, why wouldn't you have a
Mine was
replacement?
like mine was like gold or something. Like did you? I never. Oh, mine were impacted. Like I was
Really?
getting infection.
Right, yeah, you gotta lose the
Because,
baby
like,
tooth anyway.
gross and it causes like.
But yeah, guys, no root canals and baby teeth, just wait and let them freaking fall out.
I don't mind pain. You don't have
Rip mom off a couple of $100.
Instead of a root canal, why don't you just take the whole tooth and just
That's what I'm thinking.
Instead of-
Why don't they just do
avoid
an
the root
implant?
canal.
Yeah, instead of doing a root
just
canal.
take it out?
Well, you're a dentist, you wanna sell what?
Ah,
Okay,
funny.
I see.
So they can come back twice.
Because most of the times the dentist ain't doing the implant, that's out of his office.
Oh,
Your tooth is
alright.
So I ain't letting you walk out of the office when I can make, you
that's a
know.
shitty dentist though.
And then bacteria.
Well, the shitty doctors,
Then
shitty
they were like-
dentists, shitty everybody.
Take it out.
No, but then again, from
There we
their
go.
perspective.
It's hard to find a good dentist.
I found one, but they ended up taking my insurance.
And
What insurance do you have?
$11.99.
no, honestly, before I went to the room more than mine.
Yeah, no,
I don't know, like I just that's for everything. And I'd be like friction, like you know, like something like.
No, so do I. I went on a crazy one
This morning?
yesterday.
Like I know they're
Yeah.
happy.
So guys,
But I'm gonna hold that off.
listen up,
till-
guys. Next
I'm
thing
worried
you
about
need
this
to
damn
know,
model.
guys,
That
is
model.
this thing right here. This is called cementum. Okay? Cementum, guys, actually works like cement. It's going to cement the tooth or the root into the bone. Okay? And you're also going to have the periodontal ligaments. Okay? Periodontal ligaments, guys, holds the teeth. Okay? Just remember what a ligament does. It holds what? Bone to bone. Okay? All right? Okay.
The periodontal ligaments do what they hold what to what?
Hold
Bone to bone. So they're going to hold the jaw.
Jaw to the teeth.
Okay. Okay, so guys, that's it with the teeth. All
What's up
right?
for charity?
Okay.
A little bit of enough.
What material?
No.
Okay, now, guys, first thing we're going to look at is a long muscular tube called the esophagus. Okay? The esophagus, guys, runs posterior to your trachea. Okay? Posterior to the trachea. Guys, characteristically, he is different because he is entirely muscle and he's usually always closed when he is not in use. Okay, so the lumen, guys, the hole going through the esophagus is usually flattened out and closed. Okay? Now, the esophagus, guys, all you need to know about him is he's just a passageway that connects your oral cavity to your stomach. Okay? Now, the way he contracts, guys, he's going to contract these smooth muscles, these circular muscles in his walls, and the contraction is called peristaltics contraction. Okay? So guys, here's a cross-sectional cut of the esophagus. Here's the opening here, guys. You can see it's all squashed. It's usually closed like this. Okay? Trachea is going to be held wide open. Okay? Now, the way he works, guys, is when we swallow food, okay, after we chew it, we call it a bolus. Okay? That is called a bolus. All right? Now, guys, when we swallow it, it's going to come down like a big ball of food. Okay? So it comes down, guys, and here you can see, guys, here's the esophagus. You see how it had a pouch out? Okay? What's going to happen is the muscle ring right here is going to contract, and it's like squeezing a tube of toothpaste, guys. If you squeeze it from the bottom towards the top, the toothpaste comes out. Okay? So that is called a peristaltic contraction. And the whole GI tract, guys, works like that. Okay? You get those contractions behind the food substance. Okay? Yes?
What exactly is
Yeah, what happens, she asked about when you swallow something and it's really slow and it hurts. Guys, what normally happens with the GI tract, right from your lips, okay? What are we mostly made out of? Water, okay? Your GI tract, guys, is a car wash, okay? Because water breaks down almost every substance known to man. Just needs what? Time, okay? Now, what happens, guys, is when you think of food, what happens in your mouth?
Water.
You salivate. If you see food on a TV commercial, what happens to your mouth?
Salivate.
You salivate, okay? If you stick something in your mouth, guys, if you take your pen and stick it in your mouth, what happens?
Salivate.
You salivate. Those are all stimuluses to start the digestive tract. Now, what is saliva, guys? It's 99.8 or some shit like that, 99.8% water, okay? Now, what we're doing, guys, the whole entire step of the way is we're constantly showering our food source with what? Water, to break it down, okay? Now, guys, we throw something big in our mouth, we have water. Our teeth is mashing it, making it into smaller particles. Our tongue is analyzing what the hell it is that you just put in the mouth, okay? And the whole time, guys, we're mixing it up with what? Water. Now, if you don't have enough saliva at the moment you swallow, what happens with the food?
Doesn't go down.
It gets stuck, okay? Has a harder time going down, okay? Drink some water, wash it down quicker, all right? Now, your mouth's releasing water, it gets into the esophagus, guess what he's secreting? Water also, okay? Now guys, the more water we add to our food, the more it breaks down. The further the molecules are allowed to travel, okay? Now, we go from the esophagus, guys, into the next organ, which is called the stomach, okay? Here's your stomach, guys, right here. Okay, here's what it looks like if you dissect somebody. It has a covering around it, just like most organs do, okay? Here's our stomach right here, guys. Now, here's the esophagus. Food drops into the stomach, okay? Now, remember, guys, the entire time we are adding what?
Water.
Water, okay? Now, what about 3 food sources that we eat, guys? Carbs, proteins, and fats, okay? Now, carbs, guys, they come apart real simple with water, okay? Take bread, throw it in water, guys, what happens to the bread? Dissolves, falls apart really fast, okay? Take a chicken, throw it in a pot of water, come back a couple of hours later, what happened to the chicken? Fell apart, right? Okay? Now, the thing is, guys, to help digest proteins, okay, the body doesn't want to wait too long. So we get help from this organ here because the stomach can produce what? Acid, hydrochloric acid, guys. And remember, proteins come apart in high temperature and low pH or high acid, okay? Breaks it down. So guys, the stomach is breaking down the breaking down the protein for us. Now, why does it have to do that, guys? Proteins are huge molecules compared to other molecules. And they're so big, guys, that they can't pass through the cell membranes to get into the cells. they have to be dismantled. So when you hit a protein with acid, what does it break down into? It's building blocks, it's amino acids, okay? Now guys, just think of having a friend in class. He's from Mexico, okay? He gets caught here at NASA Community College by good old Donald Trump, and he gets deported to Mexico, okay? You're still friends with the guy, he was really cool, hate to see him go, all right? He's down in Mexico, and he calls you up and he says, yo, you gotta do me a favor, I want one of those Harley Davidson motorcycles, okay? I'll send the money up to you, okay? You buy it for me, and I'll meet you at the fence that good old Donald put up, okay? So he sends you the money, you buy him the motorcycle, you drive it down to Texas, you're on the Texas-Mexican border, and here's your friend. He's on the Mexican side of the fence, you're on the American side of the fence. Now guys, the motorcycle's too big to get through the fence, okay? So what do you have to do? Take it apart. Start taking it apart, send the handlebars through the hole in the fence, okay? Start sending the parts through the fence. He's on the other side doing what? Putting it back together, okay? Now guys, proteins are so big, they can't be absorbed. So the acid is going to do what to them? Break them down into their parts. Now those tiny little amino acids can get absorbed. Guys, the stomach doesn't absorb shit. It is not it's not absorbing anything. From your lips, guys, to the end of your stomach, all you did was prep the food. All you did was break it down for absorption. Okay? Yes?
It's just called amino acid, right?
What's that?
Amino acid, which is when you take those, you were saying earlier, the hormones, right? They speed up the amino acid reflex. Like you get more protein into the body.
With the aminos, yeah.
With the like testosterone or.
Well, that's a hormone.
That's what I'm saying. That
yes.
also speeds it up too.
Well, it'll speed up the intake. It
Intake.
holds on to it more. Yeah.
Okay.
Yeah.
So now, let's say carbs, for example.
Yes.
So carbs get absorbed.
Carbs get broken down right away. Okay? Water does a great job taking apart carbohydrates. All right? So what we have going on is in the mouth, first thing that we're going to start working on by salivating is going to be the carbohydrates. Okay? And then the carbohydrates go through and they're just falling apart. Okay? Proteins would over time in our watery environment, but to speed it up, we use hydrochloric acid. Okay? So now, once we're there, we have trouble still digesting what?
Protein.
Not proteins, they're fat, because our digestive system's a water system. Okay? Now we got fat that is hydrophobic, and it doesn't like that. So